Hi, this is Dr. Subhakar Nadella, Senior Consultant, Clinical and Lead Interventional Pulmonologist, KIMS Hospital Kondapur. Every year, 25th September is observed as World Lung Day. Why is it important to celebrate World Lung Day? Lungs are the most important organs in our body, which has a direct contact with ambient air and the atmosphere, because of which we are very much prone to infections as well as all the pollutions, whatever we inhale. It's an organ where we have oxygenation and carbon dioxide, inhalation of oxygenation and releasing out of carbon dioxide takes place. That's the importance of lungs in our life. Why do we need to observe this day? Why was it formed? From 2017 onwards, World Lung Day was being observed because to create awareness among public regarding various lung issues, COPD, asthma, lung cancers, these are the most common causes of morbidity as well as mortality. We all know that the prevalence and incidence of lung cancer is in rise and is one of the most common cause of overall deaths, because of which creating awareness among public is very much important. This year's theme for World Lung Day is Healthy Lungs, Healthy Life. So it is divided into two parts. One at individual level and community level, the other for the systemic level. What can we do at individual and community level for a healthy lungs and healthy life? Number one, we have to breathe clean air, be smoke free, that is both active smoking as well as passive smoking. Help others in quitting smoking also. Encourage them, your friends, your neighbors, your colleagues, etc. Take active options like walking, jogging. For suppose if you want to bring something, don't book it on Blinkit or don't use a Rapido or don't use your bike. Go walk, climb the stairs, so that this will inculcate activeness in our body and this will keep our lungs healthy. Get yourself vaccinated regularly. We have common flu vaccines, pneumococcal vaccines, etc. Indian guidelines says whoever are of the age of more than 50 years, every year get yourself flu vaccines, flu shots in the month of May, June, July, and pneumococcal vaccine we have scheduled. You can just follow with your doctors. And then fight for the climate change. Be a part of the world and take your smaller steps in avoiding climate change, pollution on your behalf. Just like we all know, the most common thing now is burning of crops, pollution, increasing of vehicular traffic, etc. These all things causes a lot of air pollution. Try to use common public transport, etc., or use EV vehicles so that we can come down or minimize the pollution. Eat well, eat proper balanced diet so that your lungs are good. You have a healthy food. Yeah, the next question comes, what things we should eat and what things we should avoid. So the foods which we can eat should contain antioxidants, vitamin A, vitamin C, etc. These protects our lungs from damage and inflammation. Berries, apples, citrus fruits, carrots, green leafy vegetables, tomatoes, all these things are good. Foods which are rich in omega-3 fatty acids, like for vegetarians, flax seeds, walnuts, and for non-vegetarians, fatty fish like salmon, etc. These are good food. Protein food like poultry, fish, eggs, legumes, these are good. This helps us increasing the respiratory muscle mass. Whole grains, oats, brown rice, whole wheat bread, these things are good, which have complex carbohydrates and which helps in better digestion and which helps in decreasing CO2 carbon dioxide production. Keep yourself adequately hydrated. Hydration is also very much important, which decreases the mucus in your lungs and helps you to expectorate out whatever it is there. You can use spices, turmeric, ginger, garlic, etc., which are anti-inflammatory things. So what things which has to be avoided? Avoid processed food, fried food, sugars, drinks, carbohydrates, carbonated waters, etc. Avoid them. Processed meat, avoid them. Beans, cabbage, etc. avoid them. Things which causes bloating in your tummies, which causes pressure on the lungs, avoid them. Few people are allergic to dairy products. So in those particular people, you can avoid dairy products. If few people are allergic to sweets, which causes cough, etc. Whoever are allergic to sweets, they can avoid them. At the community level and individual level, follow these steps for a very good healthy lungs and healthy life. Whereas in the systemic level, we should have a roadmap to improve for prevention, diagnosis and treatment of different lung diseases. We should go to the doctor immediately whenever you have any symptoms, etc. And a drive has to be made to improve access to inhaled medicines. The issue with these inhaled medicines is People who have accessibility and affordability have a certain taboo that using a inhaled medicine is like not use it, or it's some kind of sin, or it's a last stage of resorts. No, that's a myth where inhaled medicines are the best medicines for lungs and they should be the first line of the treatment. In cases where the accessibility is not there or affordability is not there, there the governments and other institutes should take a lead so that make them more accessible and more affordable to the patients. So this year, this is a theme to run two campaigns. One, Road to Improve Lung Health, proper early prevention, diagnosis and treatment of lung conditions, and a drive to improve access to inhaled medicines to all the different parts of the people. Thank you.